Alright everyone, let me ask you a soul-searching question. When was the last time you got an ophthalmic exam? Just recently? A year ago? Or you have never had an eye exam ever in your life? And no, visual acuity test with its Snellen's chart alone doesn't count. Getting an ophthalmic exam might sound pointless, but in truth, an eye exam means so much more than what you might think. In this video, let me talk about why you should get a routine eye exam and how often you should get it, even if you have 20/20 vision. Let's take a look. Hi everyone, welcome to my channel. This channel dedicated to providing you with the most up-to-date eye care information. If you are new here, consider subscribing so you won't miss out on my future videos. You can also leave down any suggestion for me, if you have any, so that I know how to make my videos even better. When you are asked to have an ophthalmic exam, it is not just you go into an optometrist's office and have you look at the Snellen's chart. A standard ophthalmic exam is a series of tests that includes vision screening and dilation. During vision screening, your doctor will perform a visual acuity test and a refraction test. During a visual acuity test, doctors will have you look at the chart containing symbols or shapes, such as the alphabet, and take note of your ability to correctly identify the symbols or figures from a distance. When performing a refraction test, doctor will use different lenses and have you view an eye chart 20 feet away to determine whether light rays bend correctly into your eye. This test determines if you have a refractive error or you need a new prescription. Next is the dilation. Pupil dilation is critical in examining the health of your optic nerve, lens, and retina. Doctors will use dilating eye drops to open up your pupil to have a broader view of your eye fundus. Without dilation, examining the inside of your eye is like looking through a room through the keyhole. Dilating drops also ensure that your pupil will not get smaller when doctors shine light into your eye. Keep in mind that dilation effects will last 4 to 6 hours and your vision will be blurry. Your eyes will also be extra sensitive to light, so remember to bring a pair of sunglasses to the eye exam. Also, have someone you trust drive you home. If the doctor finds something abnormal during dilation, they may offer additional tests to check for other eye conditions, for example, glaucoma or retinal degeneration. Some people may hate having their eyes dilated because it indeed makes your vision blurry for a few hours. So if dilation is greatly inconvenient, alternatives to dilation are available, but they aren't as effective for allowing a careful examination of the back of the eye. You can ask your doctor if you absolutely need a dilation or alternative to dilation, such as the Opto's ultra-wide-field retinal imaging, can satisfy your need. An eye exam is critical for 2 reasons. First, the health of your eye is a strong indicator of your overall physical health. Routine eye exams can catch life-threatening diseases at other body sites, which can be unnoticeable at an early stage. Diabetes, high blood pressure, artery and vein occlusion, anemia, leukemia, and other vascular diseases can all be detected within the retina. The back of the eye is the only place where doctors can directly visualize the blood vessels in action. If damages occur to blood vessels at the back of the eye, then it is likely that the same injury is also happening elsewhere in the body. Let's take diabetes as an example. Diabetes is a serious condition that, when left untreated, high blood sugar will damage blood vessels and eventually lead to devastating complications, such as kidney damage, nerve damage, stroke, heart disease, blindness, and gangrene. In fact, diabetes is referred to as the emperor of all maladies. Unfortunately, diabetes often goes unnoticed. According to the Centers for Disease Control and Prevention, which is the CDC, of the 30.3 million Americans with diabetes, 7.2 million remain undiagnosed. If left undiagnosed and untreated, diabetes can cause significant and irreversible damage to the body. Diabetes can lead to an eye condition called diabetic retinopathy. At the early stage of non-proliferative diabetic retinopathy, blood vessels of the retina become weakened, and tiny bulges of blood vessels called microaneurysms can be present. However, at an early stage, diabetic retinopathy shows no visual symptoms. And in fact, many patients don't even realize they have diabetes. Through routine eye examination, you can spot early signs of diabetes and other vascular diseases, which can be life-saving in the long run. So, always keep in mind that by getting a routine eye exam, you are not only checking the health of your eye, but also your body's. Secondly, many eye diseases are silent initially, and early detection is critical for preserving vision. A notable example is glaucoma. Primary open-angle glaucoma is when the intraocular pressure slowly rises in the eye, damaging the optic nerve. Primary open-angle glaucoma is often referred to as silent because at an early stage, primary open-angle glaucoma is primarily asymptomatic. High eye pressure first damages peripheral vision, which also goes unnoticed. Patients usually notice symptoms when the optic nerve is already severely damaged. By then, treatments become less effective and the visual prognosis is much worse. With early detection, glaucoma can be controlled through medications or surgery, and the vast majority of patients can preserve vision for the rest of their life. Another noticeable example would be retinal holes or tears. Sometimes due to trauma to the head, the vitreous humor will tug on the retina, creating breaks and tears. If left untreated over time, the liquefied vitreous humor can seep into the tears and breaks and accumulate just above the retinal pigment epithelium, causing the retina to lift off from its original position. And we call this a retinal detachment. If a retinal tear is diagnosed promptly before it progresses to retinal detachment, the prognosis is usually excellent. Retinal tears are typically treated with laser or freezing procedures in an office setting. However, extensive retinal detachment requires a patient to go to the operation room, and the treatment is much more complicated, expensive, and painful. Furthermore, extensive retinal detachment means a much worse visual prognosis and a higher recurrence rate. Prevention is better than cure. A routine eye exam is an indispensable tool in preventing potentially blinding eye conditions from occurring. Speaking of which, how often should you get an ophthalmic exam? In short, your age and eye health determine how frequently you should undergo an eye exam. The American Academy of Ophthalmology recommends adults with normal vision and not at risk of eye diseases get ophthalmic exams at least once between age 20 to 29, twice between 30 to 39, at 40 years old, and every 1 to 2 years starting at 65 years old. Between age 40 to 65, the frequency of eye exams should be recommended by doctors. However, if you are at risk of eye diseases, you should have an eye exam once a year. You are considered at risk if you wear contact lenses, have a large amount of refractive error, take medications that have eye-related side effects, have had eye surgery, an eye injury, have a family history of eye diseases, or you engage in occupations that pose a threat to the eye. Once again, an eye exam is a comprehensive series of tests done by an ophthalmologist or optometrist. A simple visual acuity test does not satisfy the requirement and cannot detect eye diseases early. If you have diabetes, your eye doctor will check the condition of your eye regularly. The American Diabetes Association recommends people with type 1 diabetes have their first eye exam within 5 years of point diagnosis. After that, your eyes should be screened once a year. If you have type 2 diabetes, however, the ADA recommends you that you have your first eye exam right after diagnosis. This is because type 2 diabetes often goes unnoticed and undiagnosed for years. Retinopathy may have already begun during that time. An eye exam will determine if you already have diabetes-related eye diseases. If the eye exam determines you have the proliferative form of diabetic retinopathy, doctors will move routine eye exam to once every 3 to 6 months. Your vision will change throughout your life, so a regular eye exam is essential even if you have normal vision. In fact, you better pay more attention to your eye health because 80 to 85% of our perception, learning, cognition, and activities are mediated through vision. Yes, blindness sucks. But keep in mind that over 80% of visual impairment can be prevented by routine eye exams. Spending a few $100 and taking a day off from work won't hurt. Remember, your health comes first, and it should always be. Alright everyone, if you find this video helpful, smash the like button and recommend this channel to people around you. Eye health question of the day. How was your experience with the ophthalmic exam? Good, bad? Is everything okay? Or you spotted something pretty early and got it treated? Share your experience in the comment section below because I really want to know. You can also help others in this community by sharing your insight. Alright, thank you for watching, take care of yourself, and be well.